So having seen the causes and common symptoms of chronic pancreatitis, we are going to see what are the diagnostic modalities to find chronic pancreatitis and how it can be treated. So coming on to diagnostic modalities, unfortunately no tests are there to find chronic pancreatitis in a very early stage. So whenever patient comes with pain or passing greasy stools or with diabetes, that time itself almost more than 75% of pancreas would have been destroyed. But if we suspect it, for example it runs in genes, then if you want to identify it early, then we can do something called as fecal elastase test. Those secretions from the pancreas which come into the intestine can be tested in the motion. So fecal lipase, fecal elastase are those tests, but it is not frequently done in India. So in later stages, how it can be identified using endoscopic ultrasound. In an endoscopy, there will be an ultrasound probe at the end which will identify small structural changes in the pancreas. Or we can do a CT scan or preferably MRI scan. When this MRI is done for pancreas, it is called as MRCP. So few fecal tests, endoscopic ultrasound, CT or preferably MRCP are the diagnostic tests to identify chronic pancreatitis. So what are the treatment modalities available for chronic pancreatitis? So for pain, if the single stone blocking the duct, then it can be managed endoscopically also. So through endoscope, we can enter the pancreatic duct from the intestine, remove the stone and put a stent, that is called as ERCP, stone removal and stent placement. Certain other advanced lesions like there is a cyst or a water accumulation due to blockage of the duct, that can also be managed with endoscopy or EUS guided procedures. Is that the only option? No. If there is pain along with significant dilatation of the duct, then one can go in for surgery. There are different methods to tackle this, but commonly what is done is the portion of pancreas which is having the stones, it is removed and the duct is open and is directly joined with that of intestine so that the secretions can flow directly into the intestine. If pain is the only cause, then it can be managed with certain injections to the nerves which cause this pain. Now are these the only treatment modalities? No, this is for pain. Now for diabetes and passing of greasy stools, that has to be tackled medically. So diabetes can be tackled with the help of insulin or other hormones, and passage of greasy stools, it is due to the decrease in the pancreatic enzymes available in the food. So that has to be supplemented from external. We give artificial enzymes while taking food. So these tablets should be taken in between meals. For example, if we take 2 dosas, after eating 1 dosa, we will have this pill and have the second dosa. So treatment for pancreatitis includes pain management, which can be endoscopically or through injections or through surgery. Simultaneously, the sugar component and the greasy stool component also should be tackled. Thank you.